Have you ever come across the word pseudocyesis? Pseudocyesis. Welcome to my channel. My name is Nurse Tonia at Medic Talk by Nurse T. You can follow us on our social media handle TikTok, Medic Talk by Nurse T, Facebook, Medic Talk by Nurse T, and our YouTube channel, Medic Talk by Nurse T. Before I continue, I have a video that I would love every one of us to view, to watch, and once that is done, I'll give some explanation about the video and what I want to talk about today.
Somebody ill?
Yes, my daughter's baby's coming. It's been 3 days since she had pains.
3 days?
Yes, please come, please.
Has your daughter seen the doctor?
No, not for the labor, only for the bed cut in her head.
Hello, Rosa. Remember me?
I want to do this the old way, in my home.
There's no reason to suppose you can't. Let's see if we can get you onto the bed, sweetie.
I'm tired of waiting and sick with bearing down.
First, we'll take a look at you, and then we'll get you a cup of sweet tea. And how often are the pains?
Yesterday, 4 or 5 times an hour, and now just 2 or 3.
You'll be able to have that cup of tea in a minute. I just want to give you an internal examination, Rosa. I know you wanted to have one before, but it shouldn't be too uncomfy. Heels up to your bottom and knees nice and wide apart. That's it. Is that a pain? It's all right, sweetie. I'm just popping outside for a moment. There's no heartbeat, is there? It's worse than that, Barbara. There's no baby. What?
Pseudocyesis, also known as false pregnancy or pseudo-pregnancy or hysterical pregnancy or even phantom pregnancy. These occur when a woman feels that she's pregnant or think that she's pregnant when actually she's not pregnant. The signs, the symptoms of pregnancy will be felt by this woman or even be seen by others. And when test is done, it comes out negative. If further investigation like CT scan is being done, it shows that there is no growing fetus. What actually are the symptoms of pseudo-pregnancy or pseudocyesis? Individuals, they portray similar symptoms just like an actual pregnancy. For example, breast tenderness, morning sickness, enlarged abdomen, craving for food, forced and labor contraction, all the symptoms, real symptoms of pregnancy can be felt by this individual, though they are not actually pregnant, but they can be felt by this individual. The actual cause of pseudocyesis or false pregnancy is not known entirely, but there are major factors that can influence this to happen, which is the psychological factor and the hormonal factor. The psychological factor includes strong desire to become pregnant, multiple miscarriages, loss of a child, infertility issues, emotional trauma related to pregnancy, previous pregnancy history, anxiety and depression can also lead to this. Fear of becoming pregnant can also lead to this condition. And these are major factors that can affect a lady to make her feel that she is pregnant. Please note, pseudocyesis is very different from pregnancy delusion. Pregnancy delusion is when a lady feels she is pregnant without any symptoms of pregnancy. But pseudocyesis, there are actual real symptoms of pregnancy that portray a real pregnancy, but there is no pregnancy. Through tests and CT scan, there is no pregnancy. So there's a difference between pregnancy delusion and pseudocyesis. For those that are going through this, it is important that they seek help. It is important that they visit a therapist or an expert, a counselor, and to be able to explain to them in love and to make them understand that they are actually not pregnant. If possible, scan should be done in their presence to actually show that there is no growing living fetus in their uterus. Sometimes they can be placed on hormonal therapy to help them regulate their hormone back to normal. They can be, cancelled. Behavioral therapy will come in. So many things can help them to understand the condition they are in. They should be shown love as much as possible. They should not think that they are not sane or there's something wrong with them. Yes, they are going through a lot at this time. They are really going through a lot, and they need all the love and care from loved ones and friends, not to make them feel abnormal in the sense that they are thinking different from every other person. This individual that have already gone through a lot psychologically, and this is why they are feeling what they are feeling, and it's not their fault. So they need all the love and care possible. And with this help from us or from experts, seeking help and making them to understand that they're actually not pregnant, and also placing them on fertility treatment to maybe make them fall pregnant or get pregnant faster, it would help them to heal better.